Hi, my name is Al. I'm a Master of Public Policy student here at MScPH, and I'm here to share with you my journey to becoming an MPP student. So I think that my journey to becoming an MPP student was a little non-traditional. I didn't really have a background in poli-sci or any sort of policy background. I actually started my undergraduate degree at the University of Toronto in life sciences, particularly studying a double major in human biology and nutritional sciences. I was looking into either pursuing something in dietetics or culinary school or even sports nutrition, but then COVID hit and things kind of hit a wall, and I was kind of at a standstill of what I really wanted to do after my undergrad degree. I was also volunteering at a pharmacy at the time and decided to apply to pharmacy school on a whim of seeing what could kind of come out of that. I ended up getting into pharmacy school, and that really just began this journey of navigating this unknown and kind of taking this non-traditional journey. And I ended up graduating with my Doctor of Pharmacy and a certificate in Global Studies 4 years later. So throughout pharmacy school, I really found this interest in health systems and particularly how they influence the health outcomes for different communities. But I noticed that there were a lot of gaps in health services and the curriculum in pharmacy school that was kind of crowded with this overwhelming sense of racism and stigmatization that made it difficult for racialized and other marginalized communities to be able to access the care that they needed. And so it really wasn't until my second year in the pharmacy program that I took a management course where we were kind of instructed to put together a business proposal that really wanted to address a health problem within the community. And so me and a couple of friends kind of got together and wanted to tackle this issue of the opioid crisis, in particular because it was affecting mainly those who were racialized or queer in our community, and not even just our community, but also nationally and internationally. We ended up putting together a business model that focused on bringing harm reduction services to the communities that needed them, and we ended up winning first place in this pitch competition, and that really just kind of ignited this fire in me to take this more of a non-traditional approach to not just pharmacy, but my career and my perspectives in general, to see how I can be able to be part of a social change, a social movement within kind of healthcare, knowing that there aren't a lot of opportunities or a lot of motivation from other people to be part of that. And so this idea really kind of ignited this fire inside me to move beyond this traditional role of a pharmacist, but rather pursue a area that focused on advocating for people who needed it. So after I finished pharmacy school, I knew that I did want to pursue some more formative education, just because I left with so many unanswered questions after pharmacy school in terms of how I want to or how I see myself being a contributor to social change and health equity for marginalized people. And that's where McCall MacBain kind of came in and gave me this opportunity to pursue education without any sort of concern for financial aid. And so I was at a standstill of choosing what program I felt was most aligned with what I wanted to achieve, and just taking a deeper look into what McGill offered and the different programs here. I felt that the MPH program, which was the Master Public Health program, aligned with my interest in being able to tackle health problems. But then there was also the Master Public Policy program, which gave me the tools to be able to deal with structural changes and being able to tackle these issues from more of a governmental, structural, public policy standpoint. And kind of just looking through these different programs, there were a lot of benefits to each, but also a lot of differences that really made me kind of consider what exactly I want to take out of these programs. I felt that the MPH program really had a focus on dealing with health issues in populations and kind of the well-being of people overall. There was this focus on data-driven kind of analysis or epidemiology and navigating different health systems management through the MPH program, building the tools for people to be able to deal with different health challenges, whether that be in disease prevention, vaccine hesitancy, health disparities. I felt that that kind of touched on my interest in being able to deal with health disparities and social inequities within health services in Canada, but also globally. But then in contrast, we had the MPP program, which was more of a condensed one-year program and really was designed to help professionals who want to kind of enter the public policy space with a emphasis on designing and evaluating and implementing policy in a wide variety of different sectors. I think the benefit of kind of the MPP program was the fact that it's so diverse in terms of what you can enter. You can enter and shape policy in education, in social services, climate change, and health policy, which was my kind of interest there. And I felt that the MPP program specifically gave us the tools to be able to not only assess the needs that people needed, but then also give us the tools to use policy as kind of a delivery of a solution, and then being able to kind of move forward and monitor and evaluate the different policies that we've put forth and kind of see how it's been serving the community the way that we wanted to. And I felt that the also benefit of that is that you can kind of enter policy in through a wide variety of different ways, whether that's government, non-government, think tanks, advocacy groups, and so there was a lot more flexibility there. All of that is to say that I think that the MPH program is really tailored to those who have a specific interest in wanting to tackle health-related challenges, while the MPP is more geared towards those who want to be able to tackle social change from more systemic or social structures that are currently existing. The reason why I chose MPP is because it gave me the tools to tackle social change through a completely new and innovative area that most healthcare professionals don't actually pursue after going to school. I'm 5 months into the program and I don't regret my decision. It definitely, again, was a huge learning curve at the beginning, not really having kind of background in any sort of poli-sci. But looking at the cohort now and how diverse it is, we have a chemical engineer, we have a cardiac researcher, and so many different people from a wide variety of different sectors and experiences and expertise that really come together and want to create change in many different ways. I have found my footing here in the program and feel so welcome and have been able to really build strong partnerships with people. I would encourage anyone interested in an MPP but not of a policy background to pursue it, because you don't need a policy background to understand and contribute to complex issues, as the program is designed to equip you with the foundational knowledge and critical thinking skills. Thank you so much for listening, and I'm happy to answer any questions you have.